Hello.
Yes, doctor.
I am Dr. Bishash. I am a doctor of this clinic. May I know your name and age, please?
Yes, doctor. I am John Abraham, 32 years.
Nice to meet you, Mr. John Abraham. How can I address you?
You can call me John.
Okay, Mr. John. I have got a letter from your GP saying that you have loose motion for last 3 months. Is it right?
Yes, doctor.
So I'm going to take detailed history and I may take some notes during our conversation. Will it be okay with you?
Yes, doctor. Yes.
So can you please tell me in your own words what is happening with you?
Yes, actually, doctor, around 3 months back, I was quite well. But since then, doctor, I think I have been facing some loose motion. Okay. Uh, at the beginning, I didn't give it so much attention. At the time, I had to open up my bowel for 2 or 3 times, I think, per day. Okay. But as the days are progressing, I feel now that, doctor, I have to go on an average around 6 to 7 times per day for my bowel movement. Okay. So it's getting really embarrassing for me, doctor. What's happening with me? And I'm very much worried, doctor. Some people have told me that even sometimes some cancer can also present in this way. Some cancer in my tummy. So I'm very much worried, doctor. Is it so?
Sorry for hours about your symptoms. First, let me take detailed history and then let me explain what is happening with you. Okay.
Okay, okay, doctor.
You said that this started 3 months ago, and initially you passed 2 to 3 times, and it is increasing gradually.
Yes, doctor. Yes.
And before the onset, did you have any other abnormal symptoms, like any history of any fever or any history of travel or anything else?
No travel, doctor. No, no fever, no travel, doctor.
Okay. And can you tell me more about your stool color?
Doctor, it's more or less the same, doctor. It's not that color is almost the same like before, but I just think that it's a bit liquid, more liquid, and it's loose, doctor. Okay.
Okay. Have you ever noticed any blood in it?
No, doctor, never, never. I have never noticed any blood.
Okay. And can you tell me that have you noticed that it is difficult to flush away or float?
No, doctor, I haven't noticed like that.
Have you noticed any abnormal constituent like any oily drops or any abnormal structure, any egg, any ova or anything else?
No, doctor, no. I haven't noticed anything like that, doctor.
Okay. And when you feel this bowel movement, do you have any pain in your tummy?
Doctor, nowadays I have some pain in my tummy. I cannot just specify where it is, but I think more or less it's the whole tummy, doctor.
And have you noticed that it is related to your stool or your bowel habit or not related to your bowel habit?
No, doctor, I don't think it's so much related with my bowel habit, doctor.
And it is all over the tummy. Have you noticed that anything makes it worse or better, like eating or passing bowel or
No,
anything?
doctor, I haven't noticed, doctor. I don't know whether it's called that so much tummy pain or not. I just have some discomfort in the whole my tummy, doctor. Okay.
Okay. And can you tell me that when do you pass your bowel most times in the morning time, daytime, or night time?
And doctor, I think there is no specific time schedule, doctor, but it's true that some 2 or 3 times I had to wake up at night.
And for how long?
Hello?
And for how long you have to wake up at night?
Yeah, I had to wake up for passing my bowel, doctor. Okay.
For how long?
Well, normal time, doctor. I think I had to pass bowel once or twice.
Okay. And have you noticed that anything makes it worse, like any special types of food or anything?
No, doctor, I haven't noticed like that.
Anything makes it better? Any
No,
medication or
nothing,
anything?
doctor. Nothing, nothing.
And in the meantime, did you notice? Did you seek any medical attention?
No, doctor. This is the first time actually. I previously I had an idea that it would go away, and it's not a serious problem. But nowadays, I am very much fearful that whether I have some problem with my tummy cancer or not. So this time I have come to you.
Okay. And you have pain, and along with it, do you have any lump or any lumpy feeling in your tummy?
No, doctor.
Any feeling of throwing up or any feeling of nausea?
No, 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 doctor. No.
Any feeling of sickness?
No, doctor. But I think I have got a bit weak than before.
Okay, I'm coming for that later. And how about your appetite?
Doctor, my appetite is more or less same, doctor.
Have you noticed any changes in your weight?
Yes, that's another issue, doctor. There's another cause that why I'm so frightened, doctor. I think for the last 2 or 3 months, I have lost around 6 to 7 kgs of weight, doctor. So it's really frightening for me that I have heard that if a person has some serious disease like cancer or something like that, he or she loses weight. So is it true, doctor?
Okay, first, let me take more detailed history, then I could comment on that. And
Okay,
is your weight loss unintentional or intentional?
completely unintentional, doctor.
Okay. And I'm going to ask you a few other questions. Have you ever vomited out blood?
Never, doctor, never.
Do you have any headache?
No, doctor.
Any changes in your vision?
No.
Any changes in the color of your eyes?
No, doctor.
Any rash anywhere in your body?
No, doctor.
Any ulceration in your mouth or any ulcer in your mouth? Any
Yeah,
swelling?
doctor. Yes, yes, yes. Sometimes I feel that there was some whitish patches. Okay, in my mouth. I had some pain while having my food, and then went before the mirror and opened my mouth. I think I saw some whitish patches, doctor.
For how long you are having this?
Doctor, I think it's around 1.5 months.
Okay. And is it present all over the time or comes and goes?
Doctor, for the last 1.5 months, I think it's more or less been present.
Okay. And do you have any hot or cold preferences?
No, doctor.
Any chest pain?
No.
Any cough?
Oh, yes, doctor. Yes, yes. I have some cough, doctor.
For how
For the
long?
last 2 months, doctor, I think I have been suffering from from this cough. It sometimes it gets very nasty. But I get irritated, doctor, and the time I sometimes I feel some shortness as well when I cough too much.
Okay. And have you ever produced any phlegm?
No, doctor, I think it's been dry all the time.
When you cough more, at daytime or night time?
Doctor, there is no specific timing.
Okay. And your shortness of breath during the coughing or any other times?
Yes, doctor. When I cough vigorously, then
Okay. And have you noticed any swelling in your legs?
no, doctor.
Any shortness of breath at night?
No shortness of breath, doctor. Just when I cough.
Okay. Any racing or pacing of your heart?
No,
Okay. And any weakness at any side of your body?
no, doctor.
Any joint pain?
No.
Any changes in your skin or in changes in nails?
Doctor, I haven't noticed, doctor.
You have said that you have weakness for how long?
Doctor, I think for around 2 to 3 months, doctor. For the same time, actually, doctor, that I've started having this problem.
And, can you tell me that when do you feel the weakness? Daytime, evening time, morning time?
There is no specific time, doctor. I just feel weak, doctor.
Okay. And may I know that do you have any past medical condition?
No, doctor. I haven't no noticed any, doctor. No, no, sir.
Any high blood pressure, high blood sugar, or anything else?
No, doctor.
Okay. And any other any other any medication are you taking currently?
No, doctor. No medication, doctor.
And may I know that do you take any over-the-counter medication or any herbal products?
No, doctor, no herbal products, doctor.
Do you have any allergy to any medication?
No.
I am sorry to ask, but can you tell me that if you take any blood channel medication or any IV drugs?
Why, doctor? Why? Is it important, doctor?
Actually, this is important because this can produce this can such disease that can present with these symptoms. So uh, we try to know this, and it is not only to you. We ask it all every patient to find out if it is.
Okay, doctor. Okay, I can understand. Yeah, doctor, I have taken it since I was 25 years of age, doctor, since I was a university student.
Can you tell me more about that so I can get a better idea?
It's not regular, doctor. Sometimes I take some party drugs, okay? When I party with my friends and some other people, okay? Uh, that's when I take it actually, and I haven't taken it for the last 4 months actually, I think.
And have you ever shared needles with anyone else?
I think, doctor, once or twice I have done it, doctor.
And, I'm just asking that. Do you know that if they have any known disease or any medical condition, if you are aware of it?
No, doctor, I haven't known of any, doctor.
Okay. So I am going to ask you about your family condition. That any of your family have this type of symptoms or any symptoms that you would like to share?
No, doctor.
Okay. And is it okay if I ask you a few personal questions? It's really important to know.
You can tell me, doctor.
Do you smoke cigarette?
No, doctor.
Okay, that's fine. And do you drink alcohol?
No.
Okay, that's fine. And may I know that what do you do for a living?
Doctor, I'm actually a school teacher, doctor.
And if this condition affects your job, then I can contact the occupational healthcare department.
Okay, doctor. That would be helpful.
And may I know that whom do you live with?
Doctor, I'm alone, doctor.
And I need to ask you very personal question about your very personal life. Will it be okay?
Okay, doctor.
Do you have any sexual partner?
Sorry.
Do you have any sexual partner?
Uh, yes, doctor. I had several partners, doctor, in my life.
And if you don't mind, may I know that are they he or she?
Yeah, they were she, doctor.
And have you ever went to the sexual health clinic for any reason?
No, doctor. I haven't been.
And did you use protection like condom during that time?
Doctor, usually I take that protection, doctor, but I'm not sure. I think once or twice I might not have taken that protection, doctor.
Okay. And may I know that have you ever passed any discharge through your private parts or any ulceration in your private parts?
Doctor, I think once, 4 months back, I had some discharge, doctor, some whitish discharge, but it went away after, so I didn't take it very serious.
And can you remember that if you had ever had any sore throat, any rash anywhere in your body, and fever, this type of symptom in your life?
Doctor, yeah, I think one time I had some like this.
Okay. So, and do you have any recent travel history?
No, doctor.
May I know that what is your concern?
Doctor, what's causing this problem, doctor? It's been around 3 months now. I'm getting weak, doctor, and I just don't like this. What's happening?
Okay. 14 minutes time is up.
Okay, just
Uh,
continue.
okay. As I have taken your history and I need to examine you, then I could give you the best explanation. But as I have taken your history, several things comes in my mind,
Hmm.
including that there might be some problem with your defense system. Okay.
Okay.
So, if you don't mind, may I know that have you ever thought about HIV or such
Uh,
condition?
no, doctor. Why, doctor? I have just heard that it's a very serious bug.
Okay, I think we can talk about it later when we are confirmed about that. Actually, my one of my suspicion is that it can be a bug infection, that is HIV infection. There are certain other possibilities, like there can be some soreness in the walls of the bowel, and there might be some problem in your hormone gland, in your, we call it thyroid gland. Do you agree?
Okay, doctor.
And
Okay.
at this time, I also cannot totally rule out the possibility of cancer, but they are unlikely to be. But we need to do some uh, blood test, some imaging test, and also we may need to some special camera test so that we can be sure that what is happening with you.
Okay, doctor. Okay.
Do you have any other question for me?
No, doctor. It's all right.
So we are going to arrange this test, including the HIV test. Do you have any uh, question for that?
Well, doctor, if I come out positive, I have heard that people are people don't like those who are who comes out positive. So, shall I be kicked out of the society? What will happen to me, doctor?
Actually, I think we can discuss this later, and we can talk more in details about the HIV test and its results.
Okay, doctor. Okay.
Okay.
So, would you like to do some perform some test examinations?
Yes, first I will like to examine his abdominal system. For this, I will first go for the examination of the pulse and examination of the heart, if there is any clubbing,
No problem.
and then
But there are some pain in the right iliophosa region, in the right lower abdomen, actually. Okay.
then I will go for the any signs of any intravenous drug abuse sites and
Yes, sides.
intravenous breaking. Okay, and after that I will go for abdomen for any palpable organomegaly.
Yes. No palpable organomegaly.
Any tenderness on right iliac fossa.
Right lower abdomen tenderness.
Okay, and after that I will also auscultate the lung for any
Yes.
creeping.
Lung field is clear.
Okay, and at this time I will also take some history about fever and night sweats. We forgot.
Yeah. There is a fever and acids present.
No. So that I finished my examination.
Okay. Okay, that's all right. So, what do you think your diagnosis is? Hello.
Yes, I think
So, what do you think your diagnosis will be?
the diarrhea is probably due to some uh, uh, immunodeficiency syndrome, that is an infection with HIV that has complicated with some virus or other protozoa like cytomegalovirus or protozoa like cryptosporidium or others I forgot. And also I have other different, and also for his cough symptoms, this can be from the opportunity infection like tubercular infection, or can be due to pneumocystis cerevis infection. And
Okay.
for him, I also have other differentials, like this can be case of ulcerative colitis. This can be case of carcinoma of the colon, then can be due to some certain infection like Campylobacter infection and other uh,
Okay. 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 That's all right. That's all right. That's all right. And so, how would you like to investigate the patient?
First, I will go for the routine blood test for complete blood count to see anemia and white blood cell count level, then inflammatory markers. After that, liver function test, renal function test, urine for routine examination, and then imaging test in the form of, and then some other blood special test like ACV testing, and also and after that I will go for the imaging test like ultrasonogram of the abdomen, then chest X-ray. Then I will also go for the to find out the infection with tuberculosis. I will go for the Montauk's test and quantiferon test. And for the diarrhea, I will also go for the routine stool examination and colonoscopy.
Okay. Would you like to count his CD4, CD8 level?
Yes, first I will go for the ECG testing if there's comes positive, and also I can get some idea from the complete blood count if white blood cell is very low, especially lymphocyte count. So that
Yes, that's important, I think. Okay. Okay.
that's my next
Okay,
plan.
that's all. Yeah. So how would you like to manage the patient?
Okay, management is actually multidisciplinary. First, I will educate and counsel the patients, and after the diagnosis, if it is most likely that this can be a HIV testing, HIV disease, HIV infection, most likely with opportunistic infection. So that first, uh, if this is opportunistic infection in the chest like TB, then for that, I will need some respiratory physician referral for his antitubercular medication and for his isolation, and also for pneumocystis cerevisiae for to the respiratory physician for his bowel. I will involve the gastroenterologist, and also for his infection, I will also involve the infection disease specialist for his ACV and specialist nurse of ACV, uh, specialist nurse for ACV, and also involve my GP and my consultant.
Okay, okay. Okay. So I think that's all right for the case. Would you like to add anything?
I think I should have asked about the fever night sweats at the initial stage, very initial stage.
Yeah, you should have. I think you went a bit slow this case. Okay. I
Yes,
think you could have.
I am somewhat deranged minded. Do you want to add anything that I have missed?
Uh, well, actually, not. But while the patient was telling, I think you should have warned him about not taking recreational medications anymore, and also about uh, maintaining maintaining his taking the precautions. Okay, while having intimate relationships. I think even if he does not come out positive for HIV, these are important.
Yes.
So I think you should have told him that in the counseling part. Okay.
Yeah.
Okay. And I just don't remember, but I think you also asked about lumps and bumps. Did you ask?
I cannot remember.
Okay, but you asked about lumps and bumps in the tummy. But I think in this type of cases, a fever, night sweat, weight loss, weather preferences, lumps and bumps in any parts of the body. I think this can also be important in the neck, in the tummy, and any parts. Okay,
Okay.
because sometimes it can be lymphoma as well. Okay,
Yes.
because sometimes it can be such that there was celiac disease. Now it is uh, lymphoma. Celiac disease can transform into lymphoma as well. Sometimes if the patient comes out with some rash and he tells her, yes, I have some lumps and bumps. I feel some lumps and bumps in my groin region or sometimes under my armpits. So I think this can also go in favor of lymphoma as well. Secondary due to celiac disease. Okay, so this can be an important DD. Even lymphoma can be flagrated by HIV as well. Okay,
Okay.
so I think this can be important. And other causes you ruled out very well. Carcinoid, there is no carcinoid or other like symptoms. And cough, I think you also did very well to rule out PCP and tuberculosis. That's very, very good. And actually, what happened that okay, I think the recording can be stopped. Okay.